Hypoglycemia unawareness is a term that describes the loss of warning symptoms for the low blood sugar reaction. I mentioned to you that initially when you feel like you're having a low blood sugar reaction, you will have sweating, you will have pounding of your heart, you'll feel a little bit anxious, a little bit lightheaded. Those are symptoms that are warning you that the sugar is dropping, that the blood sugar is dropping. So you should look for help or do it yourself. Go into the kitchen, find some sugar, drink half a cup of juice or a full cup of juice, depending on whether the sugar is really dropping fast. And if the sugar is low, you can act. But patients with type 1 diabetes, especially over time, they can lose these signs and symptoms that warn them that the sugar is low. So what happens? As a result of that, they can present immediately with a seizure. They can go into coma with no clear-cut explanation because they have lost the initial manifestations of low blood sugar reactions. And they go and land into the hospital, into the emergency room. So first, I recommend that you carry some identification with you, that you should have a card, a bracelet, something that says to those who are attending you in an emergency room that you have diabetes, that you perhaps have taken an overdose of insulin or have had a reaction, and they should know that to help you quickly out of this seizure, a coma or whatever happens. So the hypoglycemia unawareness is a very serious condition, and there is treatment. You can loosen up your glycemic control. The blood sugar can be a little higher for a good 3-6 months so as to readjust your brain and let the brain understand that you're having higher and higher sugars than normal. Not too high, but between 150, 180, 120, 180. And therefore, the brain now will sense when the sugar drops, so as if regaining the warning symptoms. And therefore, after 3 to 6 months of maintenance of higher sugars, you will see that you're going to now notice a little better that your sugar is dropping. So you don't have the hypoglycemia unawareness anymore. So it is a reversible condition.